I'd like to call our February 28, 2025 Roanoke County School Board meeting to order. Dr. Soltis, can you please call the roll?
Yes, ma'am. Mr. Greenway?
Yes, ma'am. Or yes, sir. I'm sorry.
Mr. Linden?
Yes, sir.
Ms. Fashani?
Yes, sir.
Mr. Hudson?
Yes, sir.
Ms. Clemens?
Yes, sir. Item 2.01, announcement of changes in the agenda. We don't have any. Item 2.02, approval of agenda. Do we have a motion to approve the agenda?
So moved.
Second.
Dr. Soltis?
I'm sorry, I wasn't.
Call the roll.
Oh. Mr. Greenway?
Yes, sir.
Mr. Linden?
Yes, sir.
Ms. Fashani?
Yes, sir.
Mr. Hudson?
Yes, sir.
Ms. Clemens?
Yes, sir. Item 3.01, hearing of citizens for agenda topics. Do we have, Dr. Soltis, do we have anyone signed up to speak?
No, Madam Chair, no one signed up.
All right. Item 4.01, notice of termination of health clinic contract, Ms. Susan Peterson.
Good afternoon, Madam Chair and members of the board. Thank you for the opportunity to present this utilization and review on investment of the Health and Wellness Center. To review the utilization of the clinic, we analyzed the number of visits and unique patients for the fiscal year ending June 30th, 2024. The first block on this slide represents data on the number of patient visits categorized by employee group, visit type, and clinic location. The second block adds the two clinic locations together. The data shows 3 employee groups: schools, administration, including transportation, maintenance, and retirees, and unknown, where data was not recorded. The numbers in red were visits not related to the wellness incentive, and there were 2,499 in total. The biometrics and CHR visits were related to the wellness initiative, and there were 3,431 in total. The third block on this slide shows the total unique patients. The unique acute patients are a standalone group and are also included in the other column under the all patients block. If we look at all patients, there were 866 not related to the wellness incentive and 575 related to the wellness incentive. The last block provides the number of employees insured in the employee group. The number of employees is less than the number of patients that are eligible for the clinic, because spouses are also eligible for the clinic and they are not in these numbers. One measure of the clinic's impact is its return on investment. In this measurement, on the slide in front of you, we are focusing only on the current dollar claim cost avoidance. This slide breaks down the estimated claim cost avoidance for visits at the clinic based on Anthem's pricing for our plan using CPT codes. Anthem provided multiple pricing levels since they negotiate with each provider separately. We show the estimated claim cost avoidance at the lowest and highest price levels provided in order to provide an estimate of range of possible claim cost avoidance. The first block in numbers in red represent all claim cost avoidance not related to the wellness incentive. If a member had not met their deductible, the acute and lab costs would have been paid by the member. The preventative column in red, plus the next block, which is the cost of visits for the wellness incentive, represents the claim cost avoidance for the division. The last block shows the overall claim cost avoidance for all types of visits, which is between $307,493 and $444,090. The block of numbers below in the separate table, the numbers under the yellow header represent the annual fiscal year costs of the clinic, in addition to the budgeted amounts for the current year and the next year. The estimated claim cost avoidance was based on the visits for a full fiscal year of 2024. We are currently in a joint contract with the county and Western Virginia Jail Regional Authority for the Marathon Clinic services. Although there is a termination clause for 180 days or 6 months, this contract is not written with each entity separately. The county would have to renegotiate the contract with Marathon to carve Roanoke County Public Schools from the joint language. The county attorney has provided the resolution before you to execute should the school board choose to request to remove themselves from the contract. And that's all I have for you. You have the resolution in front of you.
Thank you, Ms. Peterson. Is there a motion to approve the resolution requesting that the county and the clinic provider to renegotiate the contract to remove the school division from participation?
Yes, Madam Chair, I move that the resolution be approved to request the County of Roanoke renegotiate contract number 2023-045 with Everside Health to remove the participation of Roanoke County Public Schools in terms of the contract.
Is there a second?
I'll second.
And is there any discussion?
Yes, Madam Chair. I'm all for cost savings and trying to figure out ways to save money. But I'm just not convinced at this point that this has been properly vetted. We've got 1,441 patients who have visited that in a year average, 5,930 visits in the year. Just wonder whether there may be some other options available, trying to renegotiate the current contract to make it a little more affordable. I mean, you look back a few years, it was 437,000, now it's 825,000. It's, I've had some calls today, it's certainly gonna affect our employees, and I think we're rushing this personally, so. I don't know, I can't support this today. Even though there are certainly some cost savings for it, I think we need more time for input from the employees that it's gonna affect.
Madam Chair, I'll make a comment. One, it looks to me like, 825,000, and I believe, and Susan, correct me if I'm wrong, but the contract has a written-in 5% increase starting in July. And then the following July, another 5%, and the following July, a 3%. So it's just continuing to go up. And the main issue for me here, for our employees, and a lot of them may not realize this, but, I believe you were talking last meeting that the premiums for a family would go up $107 a month is what we're looking at right now. I believe that's the figure you gave. I'm about 100% sure that's what you were giving us. So to me, $107 a month increase for insurance for families is just too much. I mean, our teachers, I believe, Mr. Bradshaw, 46,000, I believe, for a starting teacher, somewhere around there. 46,500. And what would be a mid-cap? Maybe 60? Yes, sir. So a mid-cap teacher making $60,000, and we're going to cause them to have a $100 increase in insurance a month. That's a lot of money. I'm not trying to strain families, and I understand that everybody's medical condition, I know very well everybody's medical conditions are very different than others. But I know $107 a month is going to put a hurting on a lot of people, especially those that don't make 60,000, or maybe even some of our employees that are not making the 46. That could be some of our support staff. So in doing this, it's not that we're taking away something from the employee, it's that we're actually trying to give back to the employee. This is costing us, up to $444,000, it seems. So if we were able to put that cost savings into the health reserves account, then potentially we would be able to lower that monthly insurance premium for all of our employees. So that's where I'm at with this, and that's why I support it.
I'm sure I have some comments. Yeah, so I agree with Mr. Hudson. The truth is, numbers don't lie. I looked at the data. I appreciate, Susan, you working hard to get us all that data. I know that was a lot of numbers. But the fact is, like I said, numbers don't lie. The ROI is not strong. This, is a business decision. We have to operate like we're a business. And the rates are going up, as Brent discussed, and we need to be good stewards of our taxpayer dollars. And by keeping this program, we're actually not doing that. And taking away this program actually saves all our employees money in the long run when it comes to our healthcare decisions that we have to make moving forward. So that's why I'm supporting this decision.
So, yes, Madam Chair, I'll say one thing too. My numbers will be a little bit different than the healthcare piece, because I think we can look at the healthcare piece and decipher, what needs to happen and where we're going with a lot of these decisions. But I'll flip mine to a little bit of a different angle in the way we look at this. Overall, for our health care, we're talking about filling a hole of reserves that we've been working on the last month, or, probably, 3 or 4 months, right? For bringing our reserves up for our self-insurance, because, we've had quite a few claims that have came against us. But one thing I'd like to point out is that we have a revenue sharing agreement with our counterparts at the Board of Supervisors. And this is, I'll take this on the chin, and, the rest of you don't have to say anything. But what I'd like to point out is that we're asking, or we're looking to raise projected revenue for this year another $10 million based off the backs of Roanoke County citizens. Last year we did it was probably $15 million. Nothing's changed this year. I counter that it's almost $25 million this year. And in our revenue sharing agreement, I've got the data here for what we get in our budget of projected revenue versus what actual revenue came into the county, right? So with that difference, starting out in COVID year 2020, coming through 24, COVID, is kind of a wash, and we know that was a tough year. But in the almost 4 years since then, 21, 22, 23, and 24, we have not received about $17 million in revenue that I feel we should go back and ask for from the county. I've made this known to my counterparts because if we're going to have a true revenue sharing agreement, and I like the agreement, there's nothing wrong with the agreement, although we've been squeezed over the last decade from 43% down to about 41%. My thoughts are that there's $17 million on the table from the last 4 years. Now, we're having a bit of a hiccup, and I think we ran these schools, and when I say we, I mean as a board and obviously staff has generated most of this, the way we've guided things. But I think we've done an admirable job of running the schools and keeping our costs without adding any extraordinary cost to the Board of Supervisors. We haven't went to them and asked for money, but I think that $17 million could go a long way to shoring up our insurance reserves, our teacher pay raises, and so on and so forth. Now, do I think they're going to write us a check for $17 million? No, I'm not suggesting they're going to do that. But here's an opportunity for them to step up and say, you know what, you're right. We did collect quite a few more dollars that y'all should have gotten from actual revenue versus projected. And I think it's an opportunity for us to ask, what can it hurt in showing the actual revenue received versus projected, and that's what we should be getting paid off of. I get that they don't know the revenue at the beginning of the year. I get that, but there's never been an offer to settle at the end of the year. And for me, we increased the real estate taxes greatly here the last several years because values have went up, and I don't want to get into politics, but we're supposed to be the side of giving it back to our citizens and letting them use that money the way they see fit. So for me, I would like us to see a shared responsibility here. I do agree, and I will vote agreement, not because I don't I like it. I'm sure it's a nice convenience and provide a great service, but we're at a time now where we have to look after our people and our insurance cost. So for me, I will vote, for the resolution, and I would like us to go ask for some of that money that we should have received to the schools. Thank you.
Thank you. So I don't disagree with Mr. Linden. I'm not insensitive to the fact that people are using this service, and that it maybe is not only a convenience, but maybe a savings for them as well. So, but I think when we started looking at this over the last few months, the bigger picture is that we're in a situation where we have to do something in this health care situation that we're in. And I think I personally have spent hours in meetings and on the phone trying to understand the big picture of our health insurance situation that we find ourselves in and what our options are to try to figure out what's the best thing to do for our employees. And so when we look at this and we're trying to figure out ways that we can try to save money and get us out of this situation, I think when you look at the usage, this service seems to be underutilized. That's part of it, and then also the cost of it, what it's costing us, and where we could maybe use that money in terms of the reserves and trying to bring down our costs for the employees. So, these are tough decisions that we make, but I think when you look at the big picture, we have to figure out the best course of action. I'm not sure if this has been mentioned to this point, but the other part of this is the reason we were doing this today is because removing ourselves from this contract is a process, and we want to start that process sooner than later, because staying in this for another month costs us potentially $60,000 or $70,000. So we're talking about actual dollars that we're trying to save, and that would be the reason that we were calling this special meeting today, and I think that needs to be said as well. So I don't know if anyone has anything else. All right. Dr. Soltis?
Mr. Greenway,
Yes, sir.
Mr. Linden,
No, sir.
Ms. Fashani,
Yes, sir.
Mr. Hudson,
Yes, sir.
and Ms. Clemens.
Yes, sir. All right, does anyone have anything else? Meeting adjourned.